Hello everyone, you are watching Physio Classroom channel. This is our 9th video of PNF series, and today we are going to discuss and practically demonstrate the 6th PNF technique, which is known as hold relax. Now, similar to contract relax technique, the hold relax technique also has two subtypes, namely the hold relax direct treatment technique and hold relax indirect treatment technique. In the contract relax direct treatment technique, we were focusing on resisting the isotonic contraction of the tight or the antagonist group of muscles, whereas in the hold relax direct form of treatment, we focus on resisting the isometric contraction of the tight or the antagonist muscles. So to discuss and practically demonstrate the hold relax technique, I have with me today Siddharth Kuryal, who is a physiotherapy student here at SRHU, Dehradun. The hold relax technique should be preferred over the contract relax technique in situations when the resisted isotonic contractions of the antagonist or the tight group of muscles are too painful. Also, in situations where the isotonic contractions by the patient are too strong to be controlled by the therapist can again opt for the hold relax technique and try and resist the isometric contractions. So let's quickly demonstrate and understand the different steps of hold relax technique to improve the shoulder abduction and external rotation range in a patient who is having frozen shoulder or adhesive capsulitis. So now let's say this patient is having frozen shoulder on the left side, because of which his shoulder abduction and external rotation ranges are limited. So similar to the contract relax, our first step in the treatment would be to position the joint in the end range of restriction. Now kindly note that PNF therapy recommends this positioning of the joint in the end range of restriction to be done actively by the patient against little resistance of the therapist. Passive positioning by the therapist is only recommended in situations when the active contraction by the patient is painful. So now I'm going to give a functional command to Siddharth, which will automatically incorporate the restricted motions, that is shoulder abduction and external rotation. So Siddharth, try and bring your hand, your left hand, behind your head. Good. So I'm going to give resistance to the whole pattern of the function, which is wrist radial deviation, wrist extension, forearm supination, shoulder abduction, external rotation. So Siddharth, try and bring your hand behind your head and keep going as far as you can. Keep going, keep going, keep going. Very nice. Keep going, keep going, keep going, keep going, keep going. Very nice, very nice. Can you go little more? Okay. So now the Siddharth's left shoulder joint has been put in the end range of restriction. So now comes the second step of the hold relax direct treatment, which is to resist the isometric contraction of the tight group of muscles. Now, because our shoulder abduction and external rotation ranges are limited, therefore our tight muscles are shoulder adductor and internal rotator muscles. Now the instruction that needs to be given to the patient for isometric contraction is to hold this position. So Siddharth, you need to hold this position and maintain it, and you need to match my resistance. I am going to try and give a force in the downward direction. You need to match it. Hold, 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 hold. Maintain this contraction without any movement for 5 to 8 seconds. Yes, hold it, hold it, hold it, hold it, hold it, hold it, and relax. Both the therapist and the patient should relax gradually, and when complete relaxation has taken place, the joint can again be repositioned into the newer range of restriction, and this again can be done either passively or actively by the patient against little resistance of the therapist. Now this process of isometric contraction and relaxation followed by bringing the joint into the newer range can be repeated many number of times until there is no further improvement taking place. Now, in certain situations, patient might complain of pain while producing an isometric contraction from the tight group of muscles in the end range. In those situations, the therapist can bring the joint into a different position. There is no need to be in the end range. We can bring the shoulder 5 to 10 degrees before the end range and then again continue with the same procedure. The hold relax direct treatment technique should be concluded by exercising both the agonist and the antagonist group of muscles in the newly improved range. So now let's say the pre-treatment range of the patient was about 70 degrees of abduction and 45 degrees of external rotation, and the post-treatment ranges have improved by 10 to 15 degrees. So now we need to exercise the muscle in the improved range so that patient gains control over that range and do not come back with the restricted range on the next day of treatment. So now, Siddharth, what I want you to do is try and hold your joint in this range, and now do not let me push you forward and do not let me pull you back. I am going to emphasize pushing the joint forward and pulling it back while the patient is going to maintain the joint position. Now I can exercise the agonist and the antagonist isometrically by rhythmic stabilization or isotonically by stabilizing reversals. So now, Siddharth, I want you to hold this position and do not let me push you down. Good. Hold, 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 hold. Very nice. Now do not let me pull you back. Hold, 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 hold. Very nice. So now let's move on and understand the indications and therapeutic procedure for the hold relax indirect treatment. So if patient is complaining of pain while isometric contractions in the end range or any other range, then the therapist should go for the indirect form of treatment and try and relax those antagonist group of muscles indirectly. So the first option in the indirect hold relax treatment is to exercise the isometric contractions of the synergistic muscles of the tight or the antagonist group. So for example, take the same situation, shoulder adduction is tight, internal rotators are tight. So we know that the synergist for these particular group of muscles are wrist flexors, ulnar deviators and forearm pronators. So now what we are going to do is we are going to resist the isometric contraction for these three actions and try and relax the antagonist muscles indirectly. Siddharth, try and hold the position of your hand and match my resistance. Okay? Hold, 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 hold. Very nice. And relax, relax, relax. Again, hold, 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 and relax. Okay, let's see if we can bring your joint further. Good. Good. So this was one way in which we can practice the hold relax indirect treatment. Now what if the synergistic muscle isometric contraction is also painful? In those situations we can resist the isometric contractions of the agonist movement pattern. So now because shoulder adduction and internal rotation isometric contraction are painful, so now I am going to resist the whole synergy pattern of the agonist group of muscles, which means I need to instruct properly to the patient of what I want from him. So Siddharth, now what I want you to do is try and hold this position, okay, and match my resistance. Hold, 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 and relax, 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 relax. Again, hold, 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 and relax, relax. Okay, now let's move your joint into a new range. Good. So this was all about the sixth treatment technique of PNF, which is known as hold relax. I sincerely hope that Physio Classroom channel is able to simplify the treatment concepts and procedures of PNF therapy. Do keep motivating us with your valuable comments and feedback. Keep learning, keep sharing, and stay connected.